Hi, my name's Ankit.
My name's Ellie, and welcome back to the channel In2med.
In this video, we're going to look at how to classify bacteria and which antibiotics to use.
This is really good knowledge for those pesky MCQ questions, and also it will give you a foundation for knowing which antibiotic to prescribe in different infections.
So in this video, we're going to cover how we classify bacteria, the gram-positive bacteria, the gram-negatives, and then look at a few cases and working out which antibiotic would be the most appropriate to prescribe.
We hope that you find this useful, and please do check out our infectious disease notes where we go through all of this in a lot more detail. Now, let's get started.
A really important skill is being able to know how we classify the different types of bacteria. A lot of students skip this step and simply try and learn the conditions and memorize what antibiotics we're going to use. However, if you're able to understand the key differences between gram-positive and negative bacteria, you'll automatically know which antibiotics we need to use. So, we can first classify bacteria according to their gram stain. Gram-positive bacteria have a cell wall which is made of peptidoglycan, and this actively takes up the gram stain, so they're going to stain blue. The difference with gram-negative bacteria is that whilst they have an outer cell wall which is made of peptidoglycan, they also have an additional outer membrane. This means that they don't actively take up the gram stain, and instead stain pink. After categorizing according to gram stain, we then classify according to their shape. The two main categories are cocci, which are round shaped, and bacilli, which are pencil shaped. Within these categories, we can then go further and categorize bacteria according to whether they're aerobic respirers or anaerobic. All of this is going to be crucial in helping select the right type of antibiotic.
Let's start with the gram-positive bacteria. When we think about gram-positive cocci, the two main types are staph and strep. Both of these are facultative anaerobes. Therefore, to distinguish between them, we can look at what enzymes they contain. The key distinguishing factor are staph being catalase positive. Now, if it's also coagulase positive, we know that this is Staphylococcus aureus. This bacteria grows in clusters and gives round yellow colonies. Staph epidermidis is coagulase negative and gives small white colonies. Now, if it's catalase negative, then we're thinking it's Streptococcus. These are subcategorized by whether they're hemolytic or not. The key ones for you to know about are Strep pneumoniae, which goes in Diplococci. This bacteria is also the most common cause of pneumonia. Next, we have Strep pyogenes, which is beta hemolytic. This bacteria is responsible for a sore throat, but it can lead to complications like rheumatic fever and glomerulonephritis. We also have Enterococcus faecalis, which is non-hemolytic. Moving on to the bacilli, which look like rods, we can subdivide these by whether they're aerobes or anaerobes. Obligate aerobes can only grow when oxygen is present, and this would be Corynebacterium diphtheria, which is the pathogen causing diphtheria. Obligate anaerobes, on the other hand, can only grow if oxygen is not present, such as deep in a wound. Here, one of the key species to think about is the Clostridiums. These all are spore-forming, which can be seen on the hot malachite green stain. This includes Clostridium perfringens and tetany. And finally, a really important gram-positive bacilli is Listeria. This is a cause of meningitis in the immunocompromised and in the young. You need to be aware of it when you're considering the antibiotics you're going to prescribe.
Now that we've covered the gram-positive bacteria, let's have a look at the gram-negatives. This isn't an exhaustive list, but we're going to cover the main ones that we think you need to know for medical school. Let's start off easy with the gram-negative cocci. And the main species that you need to know is the Neisseria species. This is the one that typically causes gonorrhea, but it can also cause meningitis. But these are gram-negative diplococci. They're oxidase positive and form large, white, shiny colonies. They're facultative anaerobes. And the key thing is that the type of species is distinguished by the site where the swab was taken. So if it's taken in the groin, that would be Neisseria gonorrhoeae. Alternatively, in the throat, it's Neisseria pharyngitis. Now, moving on to the gram-negative bacilli. Again, we can categorize these according to whether they're anaerobes or aerobes. If it's an obligate anaerobe, think Bacteroides fragilis. If it's an obligate aerobe, think Pseudomonas aeruginosa. These classically form really large colonies and also secrete a green pigment on agar plates. They also have a really characteristic acrid smell. Pseudomonas typically causes malignant otitis externa, and can also cause respiratory tract infections, particularly in people with cystic fibrosis. If it's a facultative anaerobe, think of two key bacteria, E. coli and Salmonella species. These both form large colonies with irregular borders, but they can be differentiated according to whether they're lactose fermenting. E. coli is lactose fermenting, whereas Salmonella isn't. Therefore, we can use Cled or McConkey plates to distinguish between the two. Now that you know how to categorize bacteria, we're going to have a look at specific examples and which antibiotics you would choose. In this video, we're not going to cover the mechanism of action of the different antibiotics. You can find that all in our infectious diseases notes. These are just some cases that you can use to test yourself and have a think about which antibiotic you'd use and why.
So our first case is a patient who was presented with a 2-week history of a red rash on their left calf. This rash is erythematous, tender and hot to touch. Now, after excluding DVT in your differential, you're now thinking about cellulitis. The cause of cellulitis is classically a staph or a strep organism. If you think back to our classification, the staph and the streps are gram-positive cocci. Therefore, we need an antibiotic that can deal with these types of bacteria. Being gram-positive, these both have a very thick cell wall, and it would make sense for our antibiotic to target this. That's why classically we use beta-lactam antibiotics. For Staph aureus, we're going to try flucloxacillin, and for streps, just the normal penicillins. And if they were resistant to this, then we could step it up with vancomycin. Now, let's move on to our second case. This patient is 10 months old and has come in with a fever, not behaving themselves, and on examination you have discovered that they have a stiff neck and photophobia. You should clearly be thinking that this could be a case of meningitis. Meningitis can be caused by a lot of things, and this isn't just bacteria, it's also caused by viruses, parasites and fungi. But when you're thinking about the different bacterial causes, there are several key organisms. These are Neisseria meningitis, Strep pneumoniae, Listeria and E. coli. As this covers both gram-negative and gram-positive bacteria, we need an antibiotic that's effective against all of these. Therefore, our go-to is a third-generation cephalosporin, such as ceftriaxone. In groups that are vulnerable, such as immunosuppressed and the young, we are also concerned about Listeria, and that's why we're going to add amoxicillin. This is because it's an added beta-lactam antibiotic to work against that cell wall. Now, on the other hand, if a 30-year-old patient presents with the similar symptoms of neck stiffness and photophobia, we're just going to cover them with ceftriaxone and not add in that amoxicillin.
So, Ellie just talked about a case about a patient who was suffering from meningitis. Now let's take this scenario. A few days later, our patient develops severe diarrhea and abdominal pain. We take a stool sample and see that he tests positive for the Clostridium difficile toxin. If you remember, this is a gram-positive bacilli, which is also an anaerobic bacteria. This bacteria colonizes the gut when the normal gut flora are wiped out using wide-spectrum antibiotics, like ceftriaxone in the previous example. So let's have a think about what antibiotic option we're going to use. So we want to look for something that's effective against anaerobic bacteria, or something that's effective against gram-positive bacteria. And that's why the first line option for mild infection is metronidazole, which specializes against anaerobic bacteria. If it's a severe infection, which is not responsive to this, then we're going to look for something stronger, and a great example would be vancomycin. This antibiotic is exclusively used against gram-positive bacteria, as it works by stopping production of the peptidoglycan cell wall. Let's now imagine that our patient had diarrhea and he tested positive for Salmonella instead. This is a gram-negative bacillus, which is also non-lactose fermenting. Normally, we wouldn't really treat infective causes of gastroenteritis with antibiotics, but let's imagine this is a really severe infection. In this case, as it's gram-negative, we can't use vancomycin, and that's why we're going to use a different antibiotic called ciprofloxacin. Ciprofloxacin is used for gram-negative bacilli and cocci, and that's why it's also used in treating urinary tract infections, like acute pyelonephritis. Don't worry if this is a lot of information to take in at once. Have a look at our infectious diseases notes, where you'll get a table with the common infections and which antibiotics we use. So we hope you found that useful, and remember to click on the link below to get access to our notes, which covers all of this in much more detail.
Please do subscribe to the channel, and we post a new video every other week. Thanks for watching and see you next time.